Hello, I'm Dr. X. Today, we're debunking some of the most persistent myths about cholesterol. Despite decades of research and clear guidelines from organizations like the American Heart Association, these misconceptions still cause confusion and sometimes lead people to make poor health decisions. High cholesterol is a major risk factor for heart disease and stroke, yet many myths make it harder to address properly. In this video, we'll go through 7 common myths, one by one. I'll explain each myth, give the real fact backed by evidence, and use simple logic, examples, and a bit of science to make it clear. By the end, you'll have a more accurate picture of cholesterol and what you can do about it. Myth 1: Only overweight people have high cholesterol. Fact: thin people can absolutely have high cholesterol. Body weight is just one piece of the puzzle. Genetics play a huge role. Some people inherit a tendency for higher LDL levels regardless of their size. Age also matters. Cholesterol often rises as we get older. And diet, even in slim folks, can push levels up if it's heavy in saturated fats or processed foods. The American Heart Association is clear: people of any body type can have high cholesterol. Thin doesn't mean safe. I've seen plenty of lean, active patients in my practice with surprisingly high numbers because of family history. So if you're thin and think you're in the clear, get checked anyway. Myth 2: You can feel when your cholesterol is high. Fact: high cholesterol is usually completely silent, no symptoms at all until it causes a problem like a heart attack or stroke. That's why it's often called a silent risk factor. You won't feel high LDL clogging your arteries. No headaches, no fatigue, no warning signs in most cases. The only way to know is through a simple blood test. Waiting to feel something means waiting too long. Regular screening catches it early, when lifestyle changes or meds can make the biggest difference. Myth 3: High dietary cholesterol, like from eggs, directly raises your blood cholesterol. Fact: for most people, dietary cholesterol has a much smaller impact than saturated fats and trans fats. Your liver makes about 80% of the cholesterol in your blood anyway, and it adjusts production when you eat more from food. Eggs are a classic example. One large egg has about 186 milligrams of cholesterol, mostly in the yolk. But recent studies, including reviews from the American Heart Association and Mayo Clinic, show that for the majority of healthy people, eating eggs, even up to 1 a day or 7 a week, doesn't significantly raise blood cholesterol or heart disease risk. Saturated fats, like in butter, red meat, or fried foods, have a far bigger effect on pushing up LDL. The takeaway: focus more on limiting saturated and trans fats than obsessing over every egg. Eggs are nutritious: protein, vitamins, healthy fats, so enjoy them in moderation as part of a balanced diet. Myth 4: Only older adults need to worry about cholesterol. Fact: the risk starts building much earlier. The American Heart Association recommends that all adults aged 20 and older get their cholesterol checked every 4 to 6 years, or more often if you have risk factors like family history, diabetes, or smoking. Plaque buildup in arteries begins in childhood and young adulthood for many people. Early detection lets you intervene sooner with diet, exercise, or meds to prevent problems decades later. I always tell young patients, think of it as preventive maintenance, like getting your car serviced before the engine fails. Myth 5: All cholesterol is bad. Fact: no, cholesterol isn't all villain. We need it to build cell membranes, make hormones like estrogen and testosterone, produce vitamin D, and help digest fats. The key is the types. LDL, low-density lipoprotein, is often called bad because high levels contribute to plaque buildup in arteries. HDL, high-density lipoprotein, is good because it helps scoop up excess cholesterol from your bloodstream and carries it back to the liver for removal. Higher HDL is protective against heart disease and stroke. So the goal isn't zero cholesterol, it's keeping LDL low and HDL healthy through exercise, healthy fats, like from nuts, olive oil, avocados, and not smoking. Myth 6. You can always control cholesterol with diet and exercise alone. Fact: lifestyle changes are incredibly important. They can lower LDL by 20 to 30% in many people, but they're not enough for everyone. Some folks have genetic conditions like familial hypercholesterolemia, where the liver doesn't clear LDL properly. FH affects about 1 in 250 to 300 people worldwide, and it often requires medication, sometimes starting in childhood, to prevent early heart disease. Statins, ezetimibe, PCSK9 inhibitors, or other therapies are often needed alongside lifestyle. If your numbers stay high despite great habits, don't blame yourself. Talk to your doctor about genetic testing or meds. It's not failure, it's smart medicine. Myth 7. Low fat on the label means it's healthy. Fact: not necessarily. Many processed, low-fat, or fat-free foods compensate by adding sugar, refined carbs, or unhealthy additives to improve taste and texture. Those extras can spike blood sugar, promote weight gain, and indirectly worsen cholesterol and heart risk. Think of low-fat cookies or yogurt loaded with added sugars. They might be low in fat but high in calories and triglycerides. Whole foods like vegetables, lean proteins, whole grains, and healthy fats, avocados, nuts, fish, are far better choices than relying on processed, low-fat labels. In summary, cholesterol isn't the simple, bad guy many think it is. It's essential for life, but imbalance, especially high LDL and low HDL, raises your risk for heart disease and stroke. The myths we debunk today lead to delayed screening, unnecessary fear of healthy foods like eggs, or over-reliance on diet alone when meds might be needed. The good news? You can take control. Get your levels checked, starting at age 20. Focus on a heart-healthy diet low in saturated fats and sugars, stay active, maintain a healthy weight, don't smoke, and work with your doctor if numbers are off. Knowledge beats myths every time. Thanks for watching. I'm Dr. X. If you have questions about your own cholesterol or want tips on getting tested, drop them in the comments. Stay heart smart, and I'll see you next time.